I had a comment asking that I do a video on COPD, which stands for chronic obstructive pulmonary disease, which is a disease of the lungs. And I thought that was a good idea and decided to make a video on respiratory disorders in general and disability. Respiratory disorders meaning problems with the breathing apparatus, mostly the lungs. So that's my topic today. Hello, I'm John Foster. I'm a medical doctor who does Social Security disability exams. And as usual, everything I say reflects my own opinions based on my own experience and study, and not the opinions of the Social Security Administration or any other medical body. Now, before I get into respiratory diseases, I had another comment that amused me. Someone mentioned that they'd struck a tree while driving at 53 miles per hour and asked, could it be the fault of the automobile? Well, as I've mentioned before, I did 27 years of emergency medicine, 5 of them in a trauma center where I would get severely injured people from auto accidents coming in by helicopter. And in those 27 years, I can tell you, I have never ever seen one driver who was at fault in an auto accident. It was always someone else's fault. So yes, it wasn't the person's fault who drove into a tree. It might have been the fault of the automobile, or it might have been the fault of the tree. Now, there are 2 common causes for difficulty with breathing in medicine. Number 1 is problems with the lungs, and number 2 is problems with the heart, such as congestive heart failure. I'm not going to be addressing heart problems in this video, just problems with the lungs. And problems with the lungs generally cause 2 major issues. The first is cough, sometimes a dry cough, sometimes coughing up phlegm, and sometimes coughing up blood. The other is shortness of breath. Now, to get started, the easiest pulmonary disease to get disability for is if you have a lung transplant. If you have a lung transplant, you automatically qualify for 3 years of disability beginning on the day of your surgery. After that, you will have a disability review to see what your condition is at 3 years out. The most common issue I see related to the breathing system in disability is COPD, chronic obstructive pulmonary disease. COPD is usually, although not always, caused by cigarette smoking. And the hallmarks of COPD are daily cough with sputum production and shortness of breath. I've always thought it odd that people warn about the risk of lung cancer from smoking. Most smokers will not get lung cancer, only a minority will. In my opinion, the real risk of smoking is COPD, because every smoker, if they smoke enough, long enough, will get COPD and will have trouble breathing, which can be anywhere from mild to severe to fatal. The second most common breathing problem I see in disability exams is sleep apnea. Now, sleep apnea is when the person has periods during sleep where they stop breathing. And this is not usually due to problems with the lungs. There are 2 common causes. The first is called obstructive sleep apnea, and this is where there are problems with the mouth or throat, where the mouth or throat will close off for a period of time during sleep, preventing any air from getting into the lungs. The second cause of sleep apnea is what's called central sleep apnea. That's where the brain will temporarily stop the lungs from breathing. Your breathing is controlled by the brain, and if the brain doesn't send signals to your breathing muscles to breathe, then breathing stops. And if you find this interesting, you might want to subscribe to my channel. I generally put out one disability-related video a week on Friday mornings. Sleep apnea can be disabling because it can cause all sorts of problems, not just stopping breathing while asleep. Some people with sleep apnea are very tired during the day and have problems with thinking and memory and sometimes depression. Sleep apnea can also cause high blood pressure, heart disease such as heart attack or congestive heart failure, and a type of heart disease related to the lungs called pulmonary hypertension, which I'm not going to get into in this video because it's pretty technical. The third most common breathing difficulty I see in disability is asthma. Asthma is a disease of inflammation and bronchoconstriction in the lungs. The bronchioles are the little tiny tubes that distribute the air throughout the lungs. And in asthma, these little tubes squeeze almost shut. In asthma, the person gets cough, shortness of breath, and sometimes sputum production, and it's usually paroxysmal. They have episodes where they get quite sick, and often episodes where they're in pretty good shape in between the sickness episodes. And the last breathing problem that I've seen with disability is cystic fibrosis. Cystic fibrosis is a genetic disease. It's inherited, where the lungs make very thick, sticky mucus, which clogs them up, causing difficulty with breathing and also causing recurrent infections in the lungs. And infections are a big problem with most lung diseases, including COPD and asthma. As you can imagine, if your lungs are already diseased and not working well, if they get an infection, they're going to get much worse. There are many other respiratory diseases, but they're rare, and I rarely see any of them in a disability exam. Now, when somebody has a respiratory disease, the first question the doctor's interested in is, does the person have a problem with shortness of breath? And like most things in disability, the more specific you can be, the better. So I classify shortness of breath as no shortness of breath at rest or with heavy exercise, minimal shortness of breath with major exertion. That might be somebody who's played tennis most of their life. Now they develop a breathing problem, but only when they're playing a competitive game of tennis. They're not short of breath walking around or going upstairs or at rest. Then there's moderate shortness of breath. This is someone who's fine at rest, fine with mild exertion. They might get short of breath after walking 3 or 4 blocks or going up 2 or 3 flights of stairs. Then there's marked shortness of breath. That would be someone who has trouble going up 1 flight of stairs or walking 1 block due to shortness of breath. Then there's severe shortness of breath, which is someone who gets short of breath just walking across the room. And then there's extreme shortness of breath, which is someone who's short of breath just sitting in a chair or on a bed. It's important to be able to describe what makes you short of breath. Some frequent answers that I get to that question that tend to be unsatisfactory are, I get short of breath mowing my yard. Well, what does that really mean? Do you use a push mower? Do you use a walk-behind mower? Do you use a riding mower? How big is your yard? How long does it take to mow your yard? Does it take 20 minutes or 2 hours? Another answer I get is, I get short of breath walking to the mailbox. Again, how far is your mailbox from your home? When physicians try to gauge shortness of breath, they usually use one of two things. How many flights of stairs a person can climb before they have to stop due to shortness of breath, or how many blocks can they walk before they have to stop due to shortness of breath. If you can find out the answer to one or both of those questions, it will really help your disability application. Another important thing to relate is, do you cough up sputum? And if you do, is it every day? Is it once in a while? What is the sputum like? Is it clear? Everybody normally coughs up a very small amount of clear sputum. Or is it what we call purulent, which means it's green or brown or yellow? And very importantly, does the sputum have blood in it? Many people with respiratory diseases have to go to the doctor or emergency department or be admitted to the hospital from time to time because their breathing gets worse, often due to infection, but there are other causes. It's very important, if you're applying for disability and you have a respiratory problem, to be able to provide records of these issues. Times when you've had to go to the doctor because your breathing was worse, or if you had to go to the emergency department, or if you were admitted to the hospital. If you were admitted to the hospital, were you in a regular treatment area, or were you in the intensive care unit? And if you were in the intensive care unit, did you have to be on a ventilator, an artificial breathing machine? People who've had to be on a ventilator generally have very severe breathing problems. Now, I've talked in the past about how for most conditions, tests such as X-rays or blood tests are supportive evidence but not main evidence in a disability claim. Breathing problems are an exception to that rule. Social Security puts great stress on tests in people who are claiming disability for respiratory problems. And there are certain tests Social Security wants everyone to provide, and certain tests that are only necessary in special circumstances. And now I'm going to go through those tests. And before I get started on the tests, here's something to note. The tests have to be done at least 2 weeks after any change in medicines for your breathing condition. So for example, suppose you've got trouble breathing and the doctor prescribes you an inhaler, a medicine that you breathe in to help your breathing. Well, you want to wait at least 2 weeks after you start using the inhaler before having any tests. Likewise, if you've been treated for a lung infection, usually bronchitis or pneumonia, or if you've had to be in the hospital for lung disease or a heart attack, your tests need to be done at least 30 days after the treatment for infection or the hospitalization for lung disease or heart attack. Now, the first test that Social Security wants on everyone is a chest X-ray. And Social Security may order and pay for a chest X-ray if they think it's necessary. A chest X-ray shows pictures of the lungs and heart. Another way to see the lungs and heart is with a CT scan of the chest. A CT scan is only necessary in some special circumstances, and Social Security does not pay for CT scans for any other reason. The next test that Social Security wants is what's called an arterial blood gas, or ABG. This is where blood is drawn from an artery, not from a vein, as is usually done, and the amount of oxygen, carbon dioxide, acid-base balance, and carbon monoxide in the blood are measured. And Social Security may order and pay for an arterial blood gas if necessary. Usually when there's problems with breathing, the amount of oxygen goes down, the amount of carbon dioxide may go up, and the blood becomes more acidic. The next essential test is what's called pulmonary function testing, or PFT. This is where you breathe into a plastic tube, usually with a clothes peg type device on your nose, so you're only breathing through the tube. And it measures how much you can breathe in and breathe out, and how quickly you can breathe out the air. Again, Social Security may pay for pulmonary function testing if necessary. The fourth test is called a DLCO, or diffusion capacity of lung for carbon monoxide. This is a test to measure how well gases can pass from the air in the lung to the blood in the lung. It's not necessary for most conditions. It is for certain conditions, such as sarcoidosis or pneumoconiosis. Social Security, again, may order and pay for a DLCO test. The fifth test is pulse oximetry. That measures how much oxygen is in the blood relative to how much oxygen the blood could carry. And this may be done at rest or at rest and while exercising. It's not necessary for all conditions. Social Security may order and pay for it. It's important to note that those home pulse oximeters, which many people now have because of COVID, their results are not accepted by Social Security. It must be a result done in a pulmonary function lab. The final test that may be necessary is what's called a sleep study. And this is where you sleep in a bed in a sleep lab, and various things are measured, including your brain waves, your heart electrical activity, your breathing activity, and the oxygen in the blood. This is only done for people with sleep apnea, and it's important to note that Social Security will not order or will not pay for a sleep study. But if you're claiming disability based on sleep apnea, in my opinion, it's essential to get a sleep study if at all possible. Finally, as with any medical condition, it's important to go to the doctor regularly. And when you go to the doctor, mention your problems. If the doctor asks you how you're doing, don't say you're fine if you're not really fine. If you have trouble breathing, if you cough, if you bring up sputum, you want that to be in your medical record every time you see the doctor. And finally, like for every other condition, Social Security really likes a specialist's opinion. Doctors who specialize in lung and breathing difficulties are called pulmonologists, and at least one visit with a pulmonologist in your medical records would be a very useful thing. Well, I hope this has been helpful, and as always, remember, if it happens, it's possible.